Diabetes mellitus, DM, encompasses a collection of metabolic disorders marked by chronic hyperglycemia due to insufficient insulin secretion by pancreatic beta cells, peripheral insulin resistance, or both. Etiology: Type 1 diabetes, insulin-dependent juvenile diabetes. This form results from an autoimmune attack on beta cells, leading to total insulin deficiency. It primarily affects children and young adults, constituting less than 10% of diabetes cases. Type 2 diabetes, non-insulin-dependent, adult-onset diabetes, characterized by insulin resistance and eventual dysfunction of beta cells. This type predominantly affects adults over the age of 40 who are overweight, sedentary, and often have hereditary predispositions. Other types include secondary diabetes linked to hormonal disorders, pancreatic damage, certain drugs, genetic disorders, and gestational diabetes during pregnancy. Pathophysiology: Type 1 involves the autoimmune destruction of beta cells leading to absolute insulin deficiency and resultant hyperglycemia. Type 2's pathophysiology involves peripheral resistance and impaired glucose utilization, culminating in elevated blood glucose levels. Symptoms: Diabetes symptoms include increased hunger, polyphagia, increased urination, polyuria, increased thirst, polydipsia, weight loss, general weakness, and fatigue. Other symptoms often involve blurred vision, slow wound healing, increased infections, and diabetic neuropathy. Complications: Acute complications predominantly affect those with poorly controlled diabetes, such as diabetic ketoacidosis, DKA, in type 1 and hyperosmolar hyperglycemic nonketotic syndrome, HHS, in type 2. Chronic complications can include macrovascular issues like coronary artery disease and stroke, microvascular complications such as diabetic retinopathy, nephropathy, and neuropathy, and others including diabetic foot ulcers and poor wound healing. Management consists of diet control, lifestyle modification, regular blood glucose monitoring, pharmacotherapy with insulin and oral hypoglycemics, and patient education on proper care and complication prevention. Summary: Diabetes mellitus is a prevalent metabolic disorder characterized by persistent hyperglycemia. Its management involves comprehensive lifestyle changes, medication, glucose monitoring, and preventive care to manage symptoms and ward off complications.